Hello everyone, I am Laureb. I am delighted to present my research on biomechanics of femoral neck system in the case of Pauwels type 3 fracture. Femoral neck fracture are among the most common type of fractures, which account for nearly 50% of the total hip fracture. Unstable Pauwels type 3 fracture with a fracture angle of 50 degree to 70 degree have the highest rate of post-operative complications. Therefore, this study investigates the effectiveness of single hole and double hole FNS for different fracture angles. And the femoral neck system is newly introduced fracture fixation implant. It can have either a single hole side plate or a double hole side plate. In this study, two cases of Pauwels type 3 fracture were considered with the fracture angle of 50 degree and 70 degree. Finite element model were prepared for both the single hole and double hole side plate FNS. The methodology adopted for this study involved the use of Soban model, which is given in this slide. The contact condition between different components were shown in the figure. Threaded portion of the screw were considered as bonded, while the remaining implant were considered as a friction contact with the coefficient of friction of 0.3. The material for the bone and implant were considered as homogeneous and elastic isotropic with Young's modulus and Poisson's ratio were provided in the table. Various active muscle force and the hip joint reactions acting on the bone are shown in figure. Now the figure shows the maximum principal strain distribution in the bone with higher strain observed in 70 degree fracture angle as compared to 50 degree fracture angle. The von Mises stress distribution in the implant is also plotted. The displacement of the implant bone assembly were 16.39 mm and 19.39 mm for 50 degree fracture angle and 70 degree fracture angle respectively. These are the results for double hole side plate angle. Similar trend is also seen in the double hole side plate FNS. Comparing the results, the maximum one mass stress and vertical displacement of the femoral head, it can be seen that the two-hole FNS experience significantly less stress and total displacement as compared to single-hole FNS. Coming to the conclusion, with the increase in fracture angle, the von Mises stress in implant increases, however, the strain in the bone decreases. With the increase in the verticality of the fracture angle, higher load was transmitted through the bone rather than the through the implant rather than the bone. In the single hole FNS for 70 degree fracture angle, von Mises stress in the implant exceed the endurance limit of the titanium alloy. Therefore, for fracture angle greater than 70 degrees, a single hole side plate FNS is not recommended. However, detailed investigation into the appropriate implant design for other physiological loading conditions are also required. Thank you.